Welcome to our channel. Today, we're diving into a critical topic. Why is healthcare so expensive, especially in the United States, compared to other countries? Whether it's a trip to the doctor, a prescription refill, or a hospital stay, the costs can be staggering. By the end of this video, you'll understand the key factors driving up healthcare costs in the United States and how they compare to systems in other countries. We'll explore everything from administrative overheads to drug pricing, from provider salaries to the use of advanced technology. Ready? Let's get started. The United States healthcare system involves a complex mix of private insurance, government programs, and out-of-pocket payments. This intricate web creates layers of bureaucracy that add substantial administrative costs. Unlike countries with single-payer systems, where one entity handles payments, the United States system requires numerous intermediaries, each adding their slice of overhead. In countries like Canada or the UK, a single-payer system streamlines administrative tasks, reducing the need for extensive personnel and processes. The result? Lower administrative costs. In contrast, United States hospitals and clinics employ entire departments just to handle insurance-related tasks. This inefficiency translates into higher costs for patients and providers alike. Doctors in the United States spend a significant portion of their time dealing with insurance paperwork, time that could be better spent on patient care. Higher administrative costs have a direct impact on the prices we pay for healthcare services. Unlike many other countries, the United States does not regulate drug prices at the national level. This allows pharmaceutical companies to set higher prices for medications. In countries like Canada and the UK, the government negotiates drug prices with manufacturers, often resulting in significantly lower costs. The United States pharmaceutical industry argues that high prices are necessary to cover the substantial research and development costs associated with bringing new drugs to market. While it's true that developing new medications is expensive and risky, the pricing strategies often result in medications being unaffordable for many Americans. For example, insulin, a life-saving drug for diabetics, costs exponentially more in the United States than in neighboring countries. High drug prices also impact insurance premiums and out-of-pocket costs. The pricing mechanisms in the United States contribute significantly to the high cost of healthcare. Doctors, nurses, and other healthcare professionals in the United States tend to earn higher salaries compared to their counterparts in other countries. While this reflects the extensive training and education required, it also contributes to overall healthcare costs. In the United States, becoming a doctor is an expensive endeavor. Medical students graduate with substantial debt, which they need to repay. This financial burden often translates into higher salaries to make the profession viable. Additionally, the demand for healthcare professionals in the United States drives up wages. Higher provider salaries aren't limited to doctors. Nurses, therapists, and other healthcare workers also command higher wages. This ensures a high standard of living for healthcare workers, but adds to the cost of healthcare services. Higher salaries for healthcare providers can lead to higher costs for procedures and treatments. The cost of hospital services, surgeries, and procedures is generally higher in the United States than in other countries. Patients in the US often do not know the cost of services until after they receive care, leading to unexpectedly high bills. In many other countries, the cost of hospital services is more predictable and transparent. For example, in countries with universal healthcare systems, the government often sets or negotiates prices for hospital services. Another factor contributing to the high cost of hospital services in the US is the use of advanced medical technology. While these technologies can improve patient outcomes, they also come with high costs. Hospitals invest in state-of-the-art equipment and facilities, which are then reflected in the prices charged to patients. The availability and use of expensive diagnostic tools, treatments, and surgical procedures contribute to the overall cost. The high cost of hospital services and procedures in the US is a multifaceted issue. The US healthcare system heavily utilizes advanced medical technology, which, while improving outcomes, also raises costs. The availability and use of expensive diagnostic tools, treatments, and surgical procedures contribute to the overall cost. Advanced medical technology includes everything from MRI machines to robotic surgery systems. These technologies require significant investment in equipment, maintenance, and training. While they offer significant benefits in terms of patient care and outcomes, their high costs are passed on to patients and insurers. In countries with lower healthcare costs, the use of advanced technology is often more regulated. Balancing the use of cutting-edge medical innovations with cost-effective care is a challenge that the US healthcare system continues to grapple with. The United States has higher rates of chronic diseases such as diabetes, obesity, and heart disease compared to many other countries. Managing these conditions is expensive and contributes significantly to overall healthcare costs. Other countries often invest more in preventative care, which helps reduce the long-term costs associated with chronic diseases. Chronic disease management involves regular doctor visits, medications, and sometimes hospitalizations. In the United States, the high prevalence of chronic conditions leads to increased demand for healthcare services. This demand drives up costs for both patients and the healthcare system. Preventative care plays a crucial role in reducing the burden of chronic diseases. Addressing the high rates of chronic diseases in the United States requires a shift towards a more preventative approach. In the United States, private health insurance is the norm, with varying coverage levels and out-of-pocket costs. Premiums, deductibles, and co-pays have been steadily increasing, adding to the financial burden on individuals. Many Americans receive health insurance through their employers, but this system can lead to gaps in coverage for the unemployed or those working in jobs that do not offer insurance benefits. The private health insurance market in the United States is highly competitive, with numerous insurers offering a wide range of plans. High insurance costs are a significant factor contributing to overall healthcare expenses in the United States. Premiums have been rising steadily, often outpacing wage growth. This means that a larger portion of household income is spent on health insurance, leaving less for other necessities. The United States system's reliance on private insurance contributes to higher overall healthcare costs and greater financial strain on individuals. Many countries with lower healthcare costs, such as the UK, Canada, and Germany, have universal healthcare systems that are publicly funded. These systems generally negotiate prices for services and medications, leading to lower costs for patients. By ensuring that everyone has access to healthcare, these countries can spread costs more evenly across the population. Universal healthcare systems often prioritize preventative care and early intervention, which helps reduce the incidence of chronic diseases and the need for expensive treatments. In Canada, the single-payer system simplifies administrative processes, reducing overhead costs and making healthcare more affordable. Germany's healthcare system combines public and private elements, offering a high level of care while keeping costs manageable. The experiences of these countries highlight the potential benefits of universal healthcare systems. The United States can learn valuable lessons from these systems to address its own healthcare cost challenges. Thanks for watching. We've explored the various factors that contribute to the high cost of healthcare in the United States compared to other countries. Understanding these factors helps us appreciate the complexity of the issue and the challenges involved in finding solutions. Don't forget to subscribe, like, and comment below with your thoughts on healthcare costs in your country. See you in the next video. We're committed to bringing you more informative and engaging content on important topics like healthcare, economics, and more. Stay tuned, and thanks for being a part of our community.